Follicular lymphoma. This neoplasm is composed of cells that resemble germinal center B cells. These cells they are CD10 positive. It occurs mostly in patients with age greater than 50 years, and male and female they both are equally predisposed to follicular lymphoma. Now let's talk about the pathogenesis. Greater than 85% of the cases, we have 1418 translocation. BCL2 gene, it moves and fuses with the IGH locus on chromosome number 14. As a result, there is overexpression of BCL2, and BCL2 is an anti-apoptotic protein. Its overexpression results in prolonged survival of neoplastic cells. There is also mutations in genes that encode histone modifying proteins. So epigenetic changes are also involved in the pathogenesis of follicular lymphoma. Now let's talk about the morphology. We have a lymph node of a patient with follicular lymphoma, and you can see distinct nodular proliferations in the lymph node. The predominant cells in most cases are the centrocytes. These cells they are larger than resting lymphocytes. They have cleaved nuclei, and this is important, and they have condensed chromatin. Next, we have a minor component that is formed by centroblasts. They are larger than centrocytes, and they have vesicular chromatin. And there is also modest amount of cytoplasm. If these centroblasts they are predominant, that occurs in rare cases, then that specific follicular lymphoma is aggressive in its course. Apoptosis and mitosis they are very rare. They are infrequent. And this is the distinguishing point between follicular hyperplasia and follicular lymphoma. In follicular lymphoma, apoptosis and mitosis they are infrequent, whereas in follicular hyperplasia, apoptosis and mitosis both are very frequent. Now let's talk about the immunophenotype. The cells they are CD20 positive as well as CD10 positive. CD10 is the marker of germinal center B cells. Now let's talk about the clinical features. So the most of the patients they have painless generalized lymphadenopathy, and bone marrow is involved in approximately 80% of the cases at the time of the diagnosis. Treatment, it is not curable, it is slow growing tumor, and the median survival here we have approximately 10 years. And if the tumor is bulky and symptomatic, then we treat the patients with cytotoxic drugs and rituximab. BTK and BCL2 inhibitors they are used in the clinical trials. Prognosis, in 30 to 40% of the patients that have their tumors transformed to the diffuse large B cell lymphoma, they have very bad prognosis. So that's all about the follicular lymphoma. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.